Are you afraid to get vaccinated due to the misleading information spreading online? Then here are the things you need to know about the COVID-19 vaccines. COVID-19 vaccines are safe and effective. Millions of people in the United States have received COVID-19 vaccines under the most intense safety monitoring in U.S. history. It is safe, including for children ages 5 years and older. These vaccines have undergone and will continue to undergo the most intensive safety monitoring in U.S. history. A growing body of evidence has shown that these vaccines are safe and effective. COVID-19 vaccines were developed using scientific methods that have been around for decades. Before recommending COVID-19 vaccination for children, scientists conducted clinical trials. The FDA gave the Pfizer-BioNTech COVID-19 vaccine emergency authorization to use in children ages 5 years through 15 years and full approval to use in people ages 16 years and older. Some people have no side effects from COVID-19 vaccines. Many people have reported side effects that may affect their ability to do daily activities, but they should go away within a few days. There is no evidence that COVID-19 vaccines cause fertility problems. The benefits of COVID-19 vaccination outweigh the known and potential risk. Reports of adverse events like allergic reactions are rare. Everyone who receives COVID-19 vaccine can participate in safety monitoring by enrolling themselves and their children ages 5 years and older in V-Safe and completing health check-ins after COVID-19 vaccination. Parents and caregivers can create use their own account to enter their children's information. COVID-19 vaccines are effective and can reduce the risk of getting and spreading the virus that causes COVID-19. So these vaccines also help children and adults from getting seriously ill even if they do get COVID-19. So there are approximately 20 million children between the age of 5 and 11 years old in the United States, and there have been nearly 2 million cases of COVID-19 within the age group during the pandemic. COVID-19 can make children very sick, require hospitalization, and some children have even died. Children with underlying medical conditions are more at risk for severe illness compared to children without underlying medical conditions. Getting children ages 5 years and older vaccinated can help protect them from serious short and long-term complications. Getting everyone ages 5 years and older vaccinated can protect the communities, the families, including friends and families who are not eligible for vaccination, and people at increased risk of severe illness from COVID-19. Once fully vaccinated, people can start doing more. After children and adults are fully vaccinated for COVID-19, they can resume many activities they did before the pandemic. CDC recommends the fully vaccinated people to wear a mask in public indoor settings if they are in an area of substantial or high transmission. Fully vaccinated people might choose to mask regardless of the level of transmission, particularly if they have someone in their household is immunocompromised or at increased risk for severe disease, or if someone in their household is unvaccinated. People who are at increased risk for severe disease include older adults and those who have certain medical conditions such as diabetes, overweight or obesity, and heart conditions. People are not considered fully vaccinated until 2 weeks of their second dose of Pfizer-BioNTech or Moderna COVID-19 vaccine, or 2 weeks after a single dose of Johnson & Johnson's by Janssen COVID-19 vaccine. You should keep using the tools available to protect yourselves and others so you can be fully vaccinated. COVID-19 vaccination is a safer way to help build protection. Children ages 5 years and older and adults who are eligible should get vaccinated regardless of whether they already have COVID-19. Since evidence is emerging that people get better protection by being fully vaccinated compared with previously having a COVID-19 infection. One study showed that unvaccinated people who already had COVID-19 are more than 2 times as likely than fully vaccinated people to get COVID-19 again. COVID-19 is still a threat to people who are unvaccinated. Some people, including children, who get COVID-19 can become severely ill, which could result in hospitalization, and some have ongoing health problems several weeks or even longer after getting infected. So even people who did not have symptoms when they are infected can have those ongoing health problems.